McInerney from Croaky here, and I'm here with Dr. William Karesh. I've pronounced it wrongly, haven't I?
That's great.
And we're at the OneHealth conference in Melbourne at the very end of it. Would you introduce yourself with your role?
Well, I'm happy to do that. Thanks for your interest. So my background is in wildlife ecology, wildlife medicine, wildlife diseases. And about 12, 13 years ago, I coined this term OneHealth to describe this interrelationship between the health of people and the health of wildlife. And hi.
We're going live.
We're live. The health of wildlife, the health of the environment, the health of animals, and the health of people. So we call that OneHealth. Because everybody used to separate it all the time and say, oh, that's a wildlife disease. Ebola is a human disease. You know, like it's all, the diseases don't care. And all we have is OneHealth. And really, we kind of kicked off after Ebola outbreaks in the early 2000s. Got to start to think about, well, what does that mean for animals? What does that mean for people? And how do we put that together? And it's really grown. So we've had 950 people here at this conference from all over the world, and this whole movement about OneHealth. And the United Nations has adopted it, and the World Health Organization has adopted it, and the OIE, the World Animal Health. So it's had big impact. And in the U.S., really it's kind of trickled through government now. And so we use it in our Defense Department, we use it in our Health Department, we use it in our Agriculture Department. And it's really about bringing those groups together to work together.
And have you been a little surprised that it's not quite so known in other areas, including here?
Yeah, I was a little surprised today to find out that it's not such a common term in Australia. Now, Australia has hosted this conference now twice, so I was assuming, it's my first time here, I was assuming it's just a widespread concept. But it's interesting, and in some ways, it's more relevant in resource-poor countries than it is in wealthier countries.
Can you explain?
Yes, because if you go to Mongolia or you go to Uganda, the health department and the agriculture department and the environment department, they don't have enough money to do everything themselves. So they kind of go like, yeah, I guess if we work together, we would have great cost savings, we'd be more efficient. So as they would say, there's that old expression, necessity is the mother of invention. So I think in a lot of countries they go like, actually this helps us solve some problems. But in a really rich country, and even in the US, the truth is, the public health department has so much money, they could just duplicate what everybody else does if they wanted to. But I think it's interesting to see that they're also coming around to see this efficiency, but also the quality of the work gets better when you bring in different groups with different thinking.
What would you say, can you identify sort of the top three emerging issues in OneHealth in the way, in terms of risks, global risks?
Yeah, well, yes, and I will, but it's always biased by opinion. And so, I think the important things are the things that are facing me every day, what I see dealing with. But today I kind of mentioned that some of these emerging infectious diseases like Ebola and SARS and MERS, and they spread around the world, or avian influenza, and they kind of slap you right in the face. So it always seems those are more. And a OneHealth approach is important because most of them are linked between animals and end up affecting humans in economics and trade, so they're devastating economically. But there's big issues like climate change and land use change. How we decide how to use the land. Should it be maintained as forest? Should it be maintained as a watershed for clean water? Or should it be developed for a farm? And those decisions really actually drive these emerging disease events. So they cause these huge outbreaks. So it's really linked. And we think about one more upstream, land use change, climate, our food systems. And so I think those are three big, huge areas. And if we could kind of start to grapple with those, our health problems would go away. We'd just see economies would be more stable, political instability would be reduced. So there's a lot of side benefits from addressing them.
There was part of the discussions that you were in today were about how to communicate those risks and those problems, and how you particularly do it in what we're now calling a post-truth environment, but also an area where there's less specialization of the media, there's more contestability around evidence, etc. What were your takeaways from that session? What needs to be done to actually put put some solutions on the ground?
They're complex, so I don't think there's one solution. But I think there's a lot of different approaches that can be taken. It depends on who your audience is. So if we want the public to understand, because I'm a big believer in civil society, and that governments follow along, and what we as citizens demand, over time at some point gets up there, and the government has to be responsive. It might not always be fast, but there is a process there in place. So I think one is engaging the public on these issues. Now, some of the people are saying, well, journalists aren't interested, or there's fake stories, there's bad news, or whatever. Okay, fine, that's always going to happen. But we have social media, so everybody can reach out that way, just like we're doing now. How about if newspapers aren't interested in the story? Well, we know Beyonce Knowles has 9 million followers on Twitter, or could we engage, some of those people that could say the message for us? If me as a scientist is not so interesting to the news media, I think there's a lot of caring people that have big names. As Kim Kardashian starts to talk about land use change would be fascinating and provocative. And I think people would start to think, well, obviously there must be something here to think about.
Which brings us to perhaps one of the biggest people on Twitter, and I said to you before, you're one of the few people who've said to me you've welcomed the election of Donald Trump, who is of course very big on Twitter. Can you say why you have, and why you would think also, given that climate change and things like that are big issues, that's actually going to be a welcome step?
Okay.
I think it's another complex response.
Yes, I like to have a little disruptive approach. And I'm not politically active, and I don't take sides on all those things. But I do try to see what's positive and possibilities and opportunities. So I do think with President-elect Trump, as he comes in, for one thing, he's disruptive. And I think sometimes that's not such a bad thing, a little. I know government likes to be stable. But we know every government in every country in the world could do a little better. Okay, so maybe there's a little nudge there. And I think with Mr. Trump that he's very concerned about health issues. These are big issues for him. He really believes in public health. He believes in security and defense and safety. So I can imagine those are going to be kind of priority issues. And in our world, this world of OneHealth, we need that kind of support. We need people to understand that what we do here affects people's health. What you do there affects people's health. And the more attention we can get on that, I think it's the better.
How do you know he cares deeply about public health?
Well, in his first, within days after the election, he started saying that to save money, he was going to freeze government jobs, except in the areas of public health, security, and then defense.
Okay.
So, right away he said, I'm not messing with those. Those programs are going to grow.
So maybe you're a big Twitter person is going to be him convincing him about climate change, and he could tweet that.
Maybe, but he's already rethinking that, isn't he? He does bring in smart people, and so I don't know. I'm not the one to understand politicians and how that works. So we'll see what happens.
What's been the greatest gain
I don't,
in OneHealth?
I don't want to the alternative would be so pessimistic and go home and do nothing.
Yes.
So I'm not, and that's not my personality. I'm an optimist. I'm going to figure out some solution to make things work.
What do you see as the greatest gain over the past 20 years since you termed OneHealth?
The greatest gain? I think this, the level of enthusiasm and matching, and I'm not saying it just in government, even in the private sector. You see big companies coming in. The food industry is really interested in this concept of OneHealth because they know it's in their best interest for a business. It makes sense. The insurance industries are really kind of interested in this. Well, why? Well, they don't want to lose money. They're in business to be in business, but they kind of see that some of these things are cost-effective approaches. And university students, the whole next generation, they get it right away. So it's a beautiful thing to see.
Fantastic. Thank you very much.
Thank you.